Hello, my name is Darwich, and today I will be informing you on fentanyl. Pharmaceutical fentanyl is a synthetic opioid pain reliever. It is approved for treating severe pain, typically related to advanced cancer pain. It's very similar to morphine, but it's 50 to 100 times more potent. It is a prescription drug that is also made and used illegally. In fact, it is the most potent opioid pain reliever available for use in medicinal treatment. It is also sometimes used to treat patients with chronic pain who are physically tolerant to other opioids. When prescribed by a doctor, fentanyl can be given as a shot, a patch that is put on a person's skin, or as lozenges that are sucked like cough drops. The illegally used fentanyl, most often associated with recent overdoses, is made in labs. This synthetic fentanyl is sold illegally as a powder, dropped on blotter paper, put in eyedroppers and nasal sprays, or made into pills that look like other prescription opioids. Fentanyl is sometimes mixed with heroin. Because it is much more potent than heroin, there is a huge increase in risk of overdose and death. Like other Schedule II drugs, fentanyl is in this class because it has a high potential for abuse. It has a currently accepted medical use in treatment in the United States, and its abuse may lead to severe physiological or physical dependence. Synthetic opioids, including fentanyl, are now the most common drug involved in drug overdose deaths in the United States. For example, in 2017, 59% of opioid-related deaths involved fentanyl compared to only 14.3% in 2010. That's a 400% increase. The chart on the left shows that about 3,000 people died from fentanyl in 2010, and just 6 years later, that number was over 20,000. In the map on the right, we can see that states in the east are the ones most affected by the fentanyl epidemic. Reports from law enforcement indicate that much of the synthetic opioid overdose increase may be due to illegally or illicitly made fentanyl. This will be an important factor as we will see in the next slide. Here we can see that the number of people testing positive for fentanyl in some of the states that we saw on the previous slide have recently skyrocketed, even though the number of fentanyl prescriptions has remained stagnant. This can only be explained by illegal fentanyl sources. Fentanyl depresses the respiratory centers and the cough reflex and constricts the pupils. It can work within minutes to relieve pain and produce sedation. Fentanyl has a short duration of effect, just 30 to 90 minutes. Here are some of the effects fentanyl has. They include extreme happiness, sedation, problems breathing, unconsciousness. If the dosage is increased, signs and symptoms of fentanyl overdose include slow or shallow breathing, severe sleepiness, trouble walking or talking, feeling faint, dizzy, or confused, and even slow heartbeat. Fentanyl use can result in accidental death even with just one dose, especially if it is taken incorrectly or by someone other than the person with the prescription. The difference between a therapeutic dose and a deadly dose of fentanyl is very small. In other words, the margin of safety is extremely slim. On the right, we can see how small a fatal dose of the substance can be. Pure fentanyl is very potent and concentrated. It can lead to hypoxia, which is a lack of oxygen in the brain. This can lead to coma, permanent brain damage, and even death.